Does this make sense to you? Scenario fitting by Sceptikat. Part 8. Man killed by shark dies of coronavirus. Narrated by Andrew Mather. The deaths. Action if acting in the interest of the population. Track separately. Keep track of various categories of deaths. Those that very likely died of COVID versus with COVID. Those with the virus but no symptoms versus those that weren't tested but had COVID-like symptoms. Report these separately. UK government action. Lump everything. Counting everything including where the virus was present, even if asymptomatic and not the cause of death, as well as assumed cases based on no testing, with the result that the virus appears far more deadly to the public than it is. Number of COVID cases. Let's start with looking at the number of COVID cases reported. This is a largely meaningless number because of the overwhelming prevalence of asymptomatic or mild cases. The majority of those infected have no reason to get tested. Any country can report more COVID cases simply by choosing to test more people. The initially very limited availability of tests meant that the number of reported cases was going to rise even if the cases was not. Initially, if you had symptoms, you couldn't get tested unless you were over 65 or couldn't work from home or worked for the NHS. The bump in cases in Leicester, for example, just reflected a bump in testing. Pillar 1, green, swab testing in Public Health England labs and NHS hospitals for those with a clinical need and health and care workers. Pillar 2, red, swab testing for the wider population as set out in government guidance. Early on, mostly only very serious cases were identified, plus celebrity cases of course. Indeed, it is the case that with more testing, the reported fatality rates have been falling as more mild cases were tested. As group immunity would stop the disease spreading, finding a large number of asymptomatic and mild cases is excellent news. The headlines would have you believe that finding a number of new cases is something terrifyingly dire, when in reality it shows that the virus is much less dangerous and much more widespread than previously suggested. The number of reported cases is quite arbitrary already, based on how much testing is done and whether mild cases are tested, but the utter unreliability of tests makes this even worse. Various studies found that about half of the positives were false positives. One study found the false positive rate to be over 80%. Even the proponents of COVID tests deem the antibody test not reliable enough and the antigen test less good than the PCR test. So how good is the best testing method, the PCR polymerase chain reaction test? As it turns out, not that great. The inventor of the test himself, for which he won the Nobel Prize, said the test should not be used to detect viruses. The idea these kits can isolate a specific virus like Covid-19 is nonsense. In fact, the PCR test has an inglorious history including wrongly identifying a false whooping cough epidemic, and maybe all it tells you is that you may have had the common cold. All over the world, the accuracy of the tests was found to be poor. The experience of Tanzania in particular grabbed the headlines, where various fruits and animals tested positive for COVID. The president of Tanzania, John Magufuli, who is also a chemist, did not trust the World Health Organization or their coronavirus testing. He secretly had a variety of animals, fruits and vehicle oil tested at the National Laboratory. Even more shocking is experience of some nurses who sent in unused swabs for testing. They all came back positive. This cannot even be the failure of the test, more likely outright fraud. Could this get worse? Yes, a lot of the coronavirus tests were found to have been contaminated with the virus. Not only the test not test for COVID with any accuracy, it may infect you with COVID. Is this by accident each time? A healthcare worker's experience in 2 nursing homes seemed to suggest that after the mandatory testing, the nursing homes went from having 0 cases to having many, with lots of people dying. So based on the tests, we have very little idea whether someone does or doesn't have COVID. What happens when someone dies? Well, we don't require either a definite assertion that COVID was the likely cause of death or a positive COVID test to class a death a COVID fatality. At a time when accurate death statistics would be particularly important, the rules have been changed in ways that makes them less reliable than ever. For the reported COVID deaths, we don't know if the disease was actually present, and if it was, we don't know if it was responsible for the death. Instead of trying to get better at determining the cause of death, the sneaky term "died with COVID" was introduced for cases where the virus may have been present, but there was no reason to believe it was the primary cause of death. The official Czech estimates say 60% of those who had the virus and died did not die of the virus. No similar estimate was attempted in the UK. From 29th March, the numbers of COVID deaths have included all cases where COVID-19 was simply mentioned on the death certificate, irrespective of positive testing, and whether or not it may have been incidental to or directly responsible for the death. From 29th April, the numbers include the care home cases simply considered likely to be COVID-19. Sometimes even murder is reported as died with COVID. It might have been possible to have accurate data by examining the deceased, but the Chief Coroner issued guidance on 26 March which seemed designed to keep COVID-19 cases out of the coronial system. Normally, 2 doctors are needed to certify a death, one of whom has been treating the patient or who knows them and has seen them recently. That has changed. For COVID-19 only, the certification can be made by a single doctor, and there is no requirement for them to have examined or even met the patient. BMA letter instructs GPs that a telephone consultation in the last 28 days is sufficient to establish that the person may have had COVID-like symptoms. In such a case, the death certificate must state coronavirus as the cause of death. BMA guidance encourages classifying even low probability cases as COVID deaths. The BMA letter on verification of death, completion of medical certificates of cause of death, April, says it is important that likely COVID-19 deaths are reported as such. This has led to some doctors going so far as saying, here we are putting all elderly deaths as COVID-19. As the symptoms of COVID are very similar to the symptoms of the common cold or the flu, the reported number of COVID deaths is obviously inflated, since a telephone conversation in the last few weeks is sufficient basis to class a fatality a COVID death. The NHS adding vague symptoms like loss of taste to the list only serves to further increase the number of COVID diagnoses. A lot of data are unreported. For example, how many are dying of COVID acquired in hospitals? Data presumably exists on this, but are not released. Or why is the average age of those who died not reported? If we calculate this from the ONS data for May, the average age works out at around 87, as more than half of those who died were over 90. In April it was 85, in March 84. Meantime, life expectancy in the UK is 81. It is valuable to track every piece of information. It is legitimate to count those who died with COVID present, ideally broken down into those with symptoms and those with no COVID symptoms. It is legitimate to list deaths where there was no opportunity for testing as likely COVID, if indeed it was likely COVID, but these categories should be counted separately from deaths where the presence of the virus was confirmed and it likely was the cause of death. In summary, everyone who dies with COVID is listed as a COVID death, including those who had no COVID symptoms and very obviously died of something else. The inaccuracy of COVID tests and the large number of false positives further exacerbates this. At the same time, GPs have been instructed to list anyone with COVID-like symptoms as a COVID death, even if they didn't test positive. Tracking all of these makes sense. Adding them all up and calling them COVID deaths is wildly inaccurate and serves to significantly inflate the reported number of COVID fatalities. Sceptikat says this makes no sense. Join us for part 9, Why So Callous About Lives Lost if They Didn't Die of or with COVID. Thank you for watching. You can reach me, Kat, Sceptikat, at sceptikat@peerlessreads.com, Andrew and Kat see that, or privately at kat@sceptikat.com.